Hello, and welcome to Detangling Dentistry's most difficult discussions and dilemmas. What is your worst nightmare as a dental professional? I asked that question to about 35 seasoned dentists a few years back, and 100% of them described a situation that was emotional in nature rather than clinical. As a director of peer review in the state of Minnesota, I hear firsthand from patients about issues that started out in the clinical realm, but eventually involved an emotional disconnect that was big enough for them to go outside of their dental office to try to seek some resolution. Now, why is this? Well, it's important to know that just to start out with, that 30 to 80% of our patients express fear and anxiety associated with receiving dental care. And dental professionals have twice the levels of anxiety and depression as the general population. And what do we do when those patients come to see us? Why is that? Well, we prod, we poke, we stick with needles, and we drill, and they see the dust of their teeth flying out of their mouth. It's a wonder our patients sit still the way they do, but they do that because they understand that that is what is necessary for them to be able to keep their teeth the rest of their lives. Most dentists believe that emotional issues in a dental office will just take care of themselves, but I disagree. I believe that managing emotional emergencies, and I define an emotional emergency as anything emotional that interferes with our patient care, is an extremely critical part of our team management. I believe that managing emotional emergencies needs to be part of our standard of care. We need to write down how we do it. And when it's done well, it improves clinic outcomes and it enhances patient and team loyalty. And who does not want to enhance team loyalty right now? It also increases productivity because when the team is working together, things are going to be done much more efficiently. So be prepared. How can we be prepared for this? We need to educate our entire team to manage conflict, just as you would train them to sterilize instruments. So there are 3 keys to managing difficult dilemmas. They are to stay calm, tell the truth, and make it right. How do we stay calm? Well, the neurobiologists have found so much interesting research lately on how to stay calm, and the keys to staying calm are all on our brains. First of all, let's meet our amygdala. Our amygdala is a part of our brain way down in the basic kind of primitive area in our brain that controls our fight, flight, or freeze mechanisms in difficult situations. The amygdala's job is to alert us that we are entering dangerous territory, and it plays a major role in processing anger and anxiety, all of which are involved in these difficult situations. The freeze mechanism might be helpful when we're processing things in verbal conflict, as we just take a couple of minutes to figure things out. But the flight or the fight reaction is typically inappropriate for most situations in the dental office, and you might find yourself overreacting. You might find yourself having an amygdala attack. And we have all been there. Haven't you been there when you just want to, you're so angry and you kind of lose control? Amygdala attacks are terrible to have in a dental office. They get you into a lot of trouble. So how do we manage them? Well, when your amygdala goes crazy, there's a couple of things you can do. First of all, count to 10 in your head. Don't count to 10 in front of the patient. That doesn't work well. Find a focus object. Try to focus your brain on something else to just calm that amygdala down. Practice mindfulness, very important when it comes to controlling your amygdala. And take deep breaths. Again, not so that the patient's going to notice them, but just take a deep breath to clear your head when it comes to an amygdala attack. And research has shown that sometimes sour candy, something that's going to distract you from that amygdala attack, is helpful. So you might want to keep a little sour candy around. It's terrible for your teeth. It's got acid, stickiness, and sugar, but when it comes to an amygdala attack, it might be helpful. Fortunately, we have a part of our brain that also helps to control our amygdala, our prefrontal cortex. the control center right in the front. The prefrontal cortex serves as the amygdala control center, and it can overcome the anxiety and anger that's triggered by our amygdalas. The prefrontal cortex, especially when it's well trained through mindfulness and use, focusing on that prefrontal cortex, especially works well to keep you calm. So when you encounter a difficult situation or difficult discussion, speak through your prefrontal cortex and not your amygdala. One of the best examples I can tell you about for me occurred years back, probably 20 years ago, when I was doing an interview for the American Dental Association, and it was supposed to be a fluff interview about what's new in dentistry. And this was when there were 4 stations. So only 4 stations were playing. So about a fourth of the people that were watching TV would have seen this. It was kind of a big deal. And I was all ready for the fluff interview. I had my talking points all prepared. He came into the office. He was nice and friendly. Everything was good. He turned the cameras on. He got the microphone. He stuck it in my face. And he said, "Why are you dentists killing people with fluoride?" Oh my gosh, this was a hostile interview. Fortunately, I had just a quick freeze of my amygdala, not long enough to cause a problem, but a quick freeze as I processed that through my prefrontal cortex. My amygdala would have answered it a lot differently. My prefrontal cortex took the question, translated it as, "Oh, he wants to know about fluoride." And my answer was, "Well, let me tell you about fluoride. Fluoride is nature's cavity fighter. It occurs naturally in water. And what we do now is we adjust it to just the proper amounts. And in those proper amounts, the only health effect we know about is that it reduces decay. And it is a wonderful thing." That interview did not get on the TV news that night because they wanted to do an interview, a bad interview about fluoride. So fortunately, my prefrontal cortex saved the day. And when you're dealing with difficult discussions, process that information first. Don't let your anger or your unrest show or your anxiety. Process it, act calmly. The second thing we need to do is to tell the truth. One of the very best books about trust is The Trusted by David Horsager. And I love that book because it divides trust into pillars that we can kind of clearly understand. The first pillar is clarity. We need to be clear and unambiguous. We need to explain the risks, the benefits, the alternatives to care to our patients. Compassion. We need to care beyond ourselves. We need to do what's right and not what's easy, which means redo those crowns that are not correct. We need to be competent, stay fresh and capable. We need to show commitment, standing through adversity. We sure have an example of that during the pandemic, haven't we? We need to have connection with our patient. We need to ask them questions, and we need to listen to them and listen to them attentively. We need to deliver results, and we need to act consistently. This last one is kind of hard because this really means, and I find this in peer review, that you could have a wonderful experience with the patient in the office, and all of it takes is one situation. If they go to the front desk and the front desk person is not nice to them, or they feel that they're not nice to them, or they see some conflict in the office, that can make that entire wonderful experience just go right down the tubes. So all pillars are necessary to promote trust, and the loss of just one takes trust away. Always do what is right for the patient and get rid of your ego. Very important when it comes to building trust. We've just been through the first 2 things that you need to do to take care of every difficult discussion and dilemma. Stay calm and tell the truth. The last part is make it right. One of the best ways to make things right is to learn how to provide an effective apology. And according to Psychology Today, an effective apology has 3 parts. You have to acknowledge something went wrong, show remorse and empathy. Come alongside that patient and just say, "Oh gosh, I'm with you." And then restitution, make things right. So you've gotten the apology down. So what are some other characteristics of making it right? First of all, explain what happened. Fix it fast. Take care of it fast. If you have an extraoperatory, put that patient in the extraoperatory. If there's somebody around, try to get it done before the patient leaves the office. If something can be fixed before they go, they're fine. If something can't be fixed, they're going to go home and think about it for a long time. So try to do it fast. Small gifts are really nice. We used to have little gift certificates, $5, $10 gift certificates that were available at the front desk, or movie tickets, small gifts, nice card, something to let them know that you care about them and you understand that the relationship between you and the patient is very important. Refer that patient out if it's something that you can't manage and you can't handle. Know when to refer. Always, always, always follow up. Call that patient the night after the procedure and follow up with that patient to make sure they're feeling okay. That is so critical. One of the best things you could ever do for patients is to call them after the procedure is done to make sure they're doing well. Sometimes you have to dismiss a patient. This is also very important to do at the appropriate time. One of the best decisions you can make sometime, if you can understand, feel that there's a little loss of trust, is to dismiss the patient. Write a very good dismissal letter. There's a number of options out there, and just make sure you're not abandoning the patient. And document, 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 document. Never forget to document. When you can establish appropriate conflict management and during those difficult times, those difficult discussions, those difficult dilemmas, you can increase productivity, patient loyalty, and office harmony. And who doesn't want office harmony these days? Good conflict management also avoids referral by the patient to the Board of Dentistry, their lawyer, or peer review. It's always best to try to take care of those things in the office. Life is short. We have enough trauma going on around us that we can't control. So take that conflict that occurs in your office and teach your team how to deal with it. Teach them how to manage and cope with the difficult discussions and the difficult dilemmas that come up every day in your dental office. You'll be so glad that you did. Thank you very much.